So this is my 166 lab video. So before going into any patient's room, you have to make sure you are checking doctor's orders. So doctor's orders on this one says daily dry dressing change, cleanse wound with normal saline, swab for CNS, and then cover with like 4x4 and secure with tape. So now we're gonna go into the room. Hello, my name is Sierra. I'll be your student practical nurse for today. What is your name?
Jason.
And your last name?
Moore.
Your date of birth?
March 27th, 1978.
Can I check your wristband, please?
Sure.
Thank you. Okay, so we're going to be changing your dressing, okay?
Sure.
So first off, I'm going to provide privacy. So I'll pull the curtain or shut the door, whatever we're in. So do you have any pain today?
Very little.
On a scale of 1 to 10.
Like 1.25.
Okay, good. Do you have any allergies?
None.
Okay, so I'm going to start with providing hand hygiene.
Can I maybe have a little bit of that too?
Just stay still. Thank you. And then we're going to put gloves on. And we're going to remove your old bandage.
Okay, it might be growing into the hair a little bit, so just be a little gentle.
I'll make sure to pull it off slow.
Okay.
Okay, here we go. Okay, so upon removal, we have to make sure that if there's any discharge, we need to note that. So if it's bleeding or pussy, and then we need to look to see if there's any signs of infection, bleeding, pussing, the color of the pus, but it looks like it's healing nicely. So this would then get documented, and I will throw this in the garbage. Okay, so now I need to remove my old gloves. Wash my hands again. And I'm gonna set up my sterile field. Put new gloves on. Hands are sticky.
How much do you guys pay for gloves?
I don't know. Okay, so we have our dressing tray. Before taking it out, we're going to look at the expiry date. Make sure we have a dressing tray. Look to see if it's open, if there's any tears or rips in the packaging, because we wouldn't be able to use it then, or if the label is wet. So it's good. So we're going to take it out. This is going to go in the garbage, and we're going to set up our dressing tray. So we have to make sure we don't break our sterile field. Can you move your arm over just a little bit? Thank you. And then these are going to go in the garbage. So our sterile field, we got to make sure we leave a 1 centimeter border around the outside, which is classified as not sterile, and the rest is sterile. So now we're going to grab our normal saline. We need to make sure that it's not expired, that we have regular sterile sodium chloride. We need to make sure that the label is not wet, it's not open, There's no damage or cracks. And we're gonna pour some into our dressing tray. But we need to lip it a little bit. So we're gonna pour some water out. And then we'll pour some into the tray. And then we'll set this aside. So now we're gonna start. Are you okay?
Yep.
Okay, we're gonna get started. So we're gonna grab one piece at a time. We're gonna wet it.
Is that like rubbing alcohol?
It's just normal saline.
Is it gonna sting?
Doesn't burn. Might sting a little because it's a wound, but it'll be good. And then we're gonna start from the inside and go around the outside in a circular motion. So now this one would go in the garbage. And then we'd grab another one.
It's starting to bleed again.
I'll get it cleaned up for you. And then we're gonna wring this one out. We're gonna go around the outside. And then this one's gonna go in the garbage as well. Now we're gonna dry it. We're gonna grab one piece. And we're gonna dab in circular motions.
You're very gentle.
Thank you. And then we're gonna throw that one in the garbage. And we'll do one more. And then this one's in the garbage. Now we are going to take a CNS swab to send to the lab. So we're gonna open the package, take the lid off, throw it in the garbage, grab our swab, and we're gonna roll it in the bed of the wound. Sorry.
That's right.
And then we're gonna carefully put this into our swab container, garbage, and we're going to make sure that we have the patient's name, the time and the date, where the wound was, and we're going to put this into our biohazardous bag with the patient's name on it, and we'll send it to the lab. So now I'm going to grab my tweezers again. Grab our 4x4 gauze, put the gauze on, tweezers back down, tape, and we need to make sure that we put the date and our initials on there to verify that we were the ones that did the wound change. So if my sterile field was broken, I would need to put the bed rails back up on the patient's bed, make sure that they are safe. I would fold my tray back up and I'd have to go and get a new one and start the whole procedure over again. So now we are done with our equipment. We can put it all back together. This would go into the garbage. Remove my bags. Provide hand hygiene. And how are you feeling?
Good.
Any pain?
No pain.
No pain. So the patient tolerated the procedure very well. Now I would chart on our interdisciplinary charting and hand it in.